You thought STIs just meant a weird itch, or a burning pee, or an awkward text to an ex. But what if I told you they could steal your ability to ever have kids? No, this isn't fear-mongering. This is what's happening right now to millions of people in their 20s and 30s. Today, we're exposing the silent, sneaky STIs that could be ruining your chances at parenthood without you even knowing it. The ones with no symptoms. The ones that do damage you can't undo. And the most dangerous one of all. It's probably not the one you think. Like comment, share, subscribe. If you've ever had sex even once, this video is for you. Let's dive in. Let me ask you a simple question. Have you ever had something growing inside you and had no clue, no pain, no fever, no weird smells, but behind the scenes, it's ruining your future cell by cell? That's chlamydia for you, the silent thief of fertility. And today, we're lifting the hood on one of the most dangerous STIs in America, especially for young people. Chlamydia is a sexually transmitted infection caused by a bacterium called Chlamydia trachomatis. Sounds like something from a sci-fi horror movie, right? Well, it kind of is, except it doesn't attack your brain. It attacks your ability to have a family. For women, it can scar the fallopian tubes. For men, it can wreck your sperm quality. And here's the kicker. Up to 70% of women with chlamydia show absolutely no symptoms. That's like having a fire in your house, but no smoke alarm. Okay, let's say you do get symptoms. Here's what you might notice. Women. Unusual vaginal discharge, white, yellow, or greenish. Burning while peeing. Pain during sex. Bleeding between periods. Pelvic or lower abdominal pain. Men, watery or cloudy discharge from the penis, burning sensation when peeing, pain or swelling in one or both testicles, itchy feeling inside the penis. Yeah, that's a thing. But again, a lot of people don't notice any of this. They think, oh, it's probably irritation from soap, or maybe it's just a random ache. Wrong. If left untreated, chlamydia moves up the reproductive tract for women. It spreads from the cervix, uterus, fallopian tubes. There, it causes pelvic inflammatory disease, PID, a super painful condition. The fallopian tubes can get scarred or blocked completely. And guess what? That makes natural pregnancy nearly impossible. For men, the bacteria can travel to the epididymis, the part of the testicle that stores sperm. This leads to epididymitis, causing pain fever and permanent sperm damage. Over time, it may lower sperm count and motility. It's embarrassingly easy to test for chlamydia. Women, simple vaginal swab or urine test. Men, urine test, or sometimes a urethral swab. Results in 1 to 3 days. It's private, non-scary, and doesn't hurt. So why do so many people avoid it? I'm scared what it might say. I don't want people to judge me. I feel fine. But remember, you can feel fine and still be on the road to infertility. Good news, chlamydia is 100% treatable with antibiotics. Usually, a round of azithromycin or doxycycline does the job. But here's the key. You and your partner both have to get treated. Otherwise, it's just a game of ping pong. You clear it, they give it back. Repeat. And, oh yeah, no sex for 7 days while taking meds. Yes, that includes oral. Don't try to bargain your way out of that. Here's how to not get chlamydia in the first place. Use condoms correctly every time, not just sometimes. Get tested regularly, especially if you're under 25 or have multiple partners. Talk openly with your partner about testing. Limit new sexual partners or at least know their status. Don't assume clean equals safe. Many people never got tested before. Let me tell you about Lena. She was 20 in college dating a guy she loved. They didn't use condoms because they trusted each other. Lena had no symptoms, no pain, no discomfort. Fast forward 10 years. She's now married. She and her husband tried for a baby. A year goes by. Nothing. 2 years. Still nothing. She gets tests done and the doctor tells her, "Your fallopian tubes are completely scarred shut. You had a pelvic infection years ago. It was likely chlamydia." Lena never even knew she had it. Her future forever changed by an infection she never felt. We reached out to Dr. Stephanie Blake, an OB/GYN and women's reproductive health researcher at UCLA, and here's what she had to say. "In my clinic, I see far more cases of infertility caused by untreated STIs than most people realize. Chlamydia is often the main culprit. The damage is slow and silent. By the time a woman notices something's wrong, the damage is done." And from Dr. Marcus Green, urologist and men's fertility specialist. Young men ignore symptoms like discharge or testicular pain, assuming it'll go away, but untreated chlamydia can damage sperm production for life. We need to start taking male fertility seriously, too. There's another couple we interviewed, Alex and Jordan. They'd been together since high school, got married at 28, and were excited to start a family. Jordan had no known health problems. Alex had a history of testicular pain but never saw a doctor. He thought it was just a sports injury. After a year of trying, they did fertility testing. Turns out Alex's sperm count was nearly 0. The cause? A past, untreated chlamydia infection that led to silent inflammation and scarring. All right, let's talk about gonorrhea. Not glamorous, not fun, and definitely not harmless. This thing has been around for thousands of years. Literally, it's mentioned in ancient Egyptian texts. Some people used to call it the drip, but now it's earning a new nickname, the antibiotic escape artist. Yeah, gonorrhea is no longer just an infection you treat and forget. It's evolved, it's resisting medication, and it's quietly destroying the fertility of millions. Let's break this one down. Gonorrhea hits men and women a little differently. For men, painful urination, thick greenish-white or yellowish discharge from the penis, swollen or painful testicles, a burning or itching feeling inside the penis, occasional sore throat if oral contact happened. Let me tell you, a guy once described it as, "It felt like I was peeing razor blades wrapped in fire, yikes." For women, increased vaginal discharge, painful urination, bleeding between periods, pelvic pain, pain during sex, fever in more serious cases. But just like chlamydia, some women have no symptoms at all, especially in early stages. They keep going, completely unaware their reproductive system is under attack. If untreated, gonorrhea spreads beyond the initial infection site. In women, the bacteria move from the cervix, uterus, fallopian tubes. This causes pelvic inflammatory disease. PID. PID leads to scarring, blocked tubes, ectopic pregnancies, and eventually infertility. In men, gonorrhea can spread to the epididymis where sperm matures, or even the prostate gland. It can cause epididymitis, which is painful and damages sperm mobility. In some cases, it can even cause urethral stricture, narrowing of the urethra, making it hard to urinate or ejaculate. Worst case scenario, disseminated gonococcal infection, DGI. That's when gonorrhea enters the bloodstream and causes joint pain, skin lesions, inflammation of the heart or brain. Not common, but very real and very serious. Let's talk about Jay, a real patient we interviewed for this episode. Jay is 32 now, works in marketing, engaged, fit, healthy. But 10 years ago, when he was 22 and partying hard, he had gonorrhea. Not once, not twice, 3 times. Each time he went to a clinic, got treated, popped antibiotics, and moved on. Nobody told him about the long-term risks. No one said, "Hey, repeated infections can actually scar your reproductive tract." Fast forward to, now he and his fiancée have been trying for a baby for over a year. Jay went in for a sperm analysis. Result, his sperm motility was near 0. His testicles looked healthy on ultrasound, but internal scarring had reduced the sperm's ability to move. Jay told us I honestly had no idea. I just assumed if the STI was gone, the problem was gone. No one talks about what these infections do years later. Here's the scary part. Gonorrhea used to be easily treated with penicillin. Then it started resisting that. So we moved to cephalosporins, azithromycin, and fluoroquinolones. Now the CDC calls gonorrhea a superbug in the making. Some strains are resistant to almost all antibiotics. Doctors are now using injectable ceftriaxone as the go-to treatment, often paired with oral doxycycline, just in case there's a co-infection like chlamydia, which happens a lot. But as Dr. Karen Lasker, infectious disease expert at NYU, puts it, we are rapidly approaching a time when gonorrhea could become untreatable using existing drugs. And if it gets into your reproductive system, the damage is often irreversible. All right, prevention time. This is where we take back control. 1. Use protection. Every single time, condoms aren't just for preventing babies, they're your defense line. 2. Don't skip testing. If you're under 25 and sexually active, get tested at least once a year. Got new partners? Test more often. 3. Talk before you hook up. No shame in saying, when was the last time you got tested? It's not weird. It's smart. 4. Limit partners. Not saying you have to be a monk, but multiple partners. Yun, higher risk 5. Don't assume anything. Someone who looks clean could still have gonorrhea. It doesn't show on your face. Even after treatment, retest after 3 months. Why? Because reinfection is super common, especially among teens and young adults. And if you've had gonorrhea once, you're more likely to get it again. Let's say this clearly. Treating it once doesn't give you immunity. We asked Dr. Anil Mehta, reproductive endocrinologist at Stanford, what he wished every teenager knew about gonorrhea. I wish young people understood that STI consequences aren't always immediate. It's like silent damage, it builds, it grows, and by the time it shows up, it's too late. Gonorrhea might not kill you, but it can kill your chance of having a family one day. Let's clear something up. When people hear HPV, their minds either go to warts, or they shrug and say, doesn't everyone have that? Both responses are part of the problem. Yes, HPV is incredibly common. By age 25, 4 out of 5 sexually active people will have had at least one type of it, but here's the thing. Some strains of HPV do a lot more than cause warts. They can change your ability to have kids forever. HPV stands for human papillomavirus, a group of over 100 related viruses. You can catch HPV from vaginal sex, oral sex, anal sex, skin-to-skin contact in the genital area. The incubation period is a tricky beast. It ranges from weeks to months, even years. And get this. You can be completely symptom-free the whole time and still pass it to others. Yeah, you could have gotten HPV from a partner 3 years ago and only now start seeing signs if they ever show up. HPV is a master of disguise. Common symptoms depending on the strain. Genital warts, soft flesh-colored bumps, warts on the throat or anus, irregular bleeding or discharge in women, chronic pelvic pain, abnormal Pap smear results. But most people show nothing. The body's immune system clears many strains on its own over 1 to 2 years. Here's the twist. The strains that do the most damage. They usually have no visible symptoms. Let's talk long-term damage. In women, high-risk HPV strains can cause cellular changes in the cervix. If left untreated, they may lead to cervical cancer. In severe cases, women need a hysterectomy removal of the uterus, and without a uterus, pregnancy is no longer possible. Not hard, not risky. Impossible. HPV can also cause chronic inflammation in the cervix, making it harder for sperm to enter or a fertilized egg to implant. Some studies also show higher miscarriage rates in women with untreated high-risk HPV. In men, there's no test for HPV in men unless they show symptoms. But HPV can lower sperm motility and damage DNA in sperm. Some strains have been linked to testicular inflammation and even throat cancer via oral transmission. Let me tell you about Rachel. She was 26, working 2 jobs. Single mom, putting her life back together after a divorce. She never missed a pap smear. Always careful, but she hadn't gotten the HPV vaccine. At her annual checkup, her doctor told her she had abnormal cervical cells. Biopsy showed stage 1 cervical cancer, caused by HPV-16. A high-risk strain. Rachel had to undergo a hysterectomy. She was devastated. I already had 1 child, but I always dreamed of having more. Maybe when I was more stable. Now that choice is gone. She had no symptoms, no pain, no idea. Does the HPV vaccine cause infertility? Let's kill this rumor right now. No. The HPV vaccine does not cause infertility. In fact, it prevents the cancers that can lead to infertility. The CDC, WHO, ACOG, and nearly every medical body worldwide backs this up. Dr. Michelle Yates, OB/GYN and professor at Johns Hopkins, says the HPV vaccine is one of the safest, most effective tools we have to protect reproductive health. It prevents cancer. It doesn't cause it. It preserves fertility. It doesn't take it away. There are 3 main types of HPV vaccines. 1. Cervarix. 2. Gardasil. 3. Gardasil 9. Protects against 9 strains, including the most dangerous ones. Most recommended is Gardasil 9, best time to get vaccinated, ages 9 to 12 before exposure, but you can still get it up to age 45. Too late for me is no longer an excuse. We sat down with Dr. Javier Mendez, reproductive immunologist from the University of California. He told us we've started to realize HPV doesn't just cause cancer. It creates chronic inflammation, changes in the cervical mucus, even subtle hormone imbalances. These can all disrupt conception and early pregnancy. He added, if you want to future-proof your fertility, the vaccine isn't just helpful, it's essential. Drop. Over 13 million new HPV infections occur annually in the U.S. Around 11,000 women develop cervical cancer each year due to HPV. About 4,000 women die annually from it. Most of these cancers are preventable with screening, plus vaccination, preventing HPV. The smart way: 1. Get vaccinated. It's safe. It's covered by most insurance, and it's for everyone, not just women. 2. Use protection condoms. Reduce risk, not 100%, but they help, especially for reducing transmission of high-risk strains. 3. Get regular screenings. Women, pap smear every 3 years from age 21. HPV co-testing from age 30. Men, no approved test yet, but checkups help detect visible warts or inflammation. 4. Talk openly with partners. Honest convo saves lives and relationships. Let's be honest for a sec. Most of us are really good at ignoring our bodies. You feel off. You blame stress. You're in pain. You pop an Advil. You notice something weird down there. You Google it. At 2 a.m., read one terrifying Reddit thread and convince yourself you're fine. But here's the deal. Your body is always talking. The question is, are you listening? When it comes to STIs and fertility risks, some of the smallest signs are actually screaming alarms in disguise. Let's walk through them one by one. Sign 1. Unusual discharge. Yeah, this one can feel awkward to talk about, but it's one of the most important red flags. For girls, discharge is normal. But if it suddenly changes color, yellow, green, gray, gets clumpy or watery, smells funky, or shows up with itching, irritation, or blood, it could be a sign of chlamydia, gonorrhea, bacterial vaginosis, trichomoniasis, or even pelvic inflammatory disease. For guys, any discharge that's not urine or semen. If something's leaking, oozing, or crusting around your penis, yeah, that's not normal. It could be gonorrhea, chlamydia, or urethritis. Sign number 2, pain. During sex. Let's be real. Sex isn't supposed to hurt. If it does, something's off. For women, pain during penetration or deep thrusting might point to pelvic inflammatory disease, PID, chlamydia or gonorrhea, endometriosis triggered by infection, cervical inflammation. For men, pain during ejaculation or after intercourse could signal prostatitis, urethritis, epididymitis, sign number 3, lower abdominal or pelvic pain. You don't need to be doubled over to know something's wrong. This kind of pain can be sharp or dull, constant or off and on, related to your cycle. Or not chronic pelvic pain is one of the earliest signs of pelvic inflammatory disease. Ovarian cysts caused by HPV. Uterine scarring. Chronic infections like Mycoplasma genitalium. For guys, lower abdominal pain can point to inflamed prostate. Urinary tract infections. STI-related testicular complications. Sign number 4, irregular bleeding between periods. This one is huge. If you're spotting between cycles, after sex, randomly without reason, it could be a sign of cervical inflammation from HPV, uterine scarring, PID, hormonal changes caused by infection, or early signs of cervical cancer. Never brush this off. Sign number 5, painful urination classic. Right, that burning feeling when you pee. Sure, sometimes it's a UTI, but a lot of the time it's actually chlamydia, gonorrhea, trichomoniasis, herpes, especially during outbreaks, or just irritation caused by STI inflammation. The key is recurrence. If it happens once and goes away, okay, but if it lingers, comes back, or gets worse, get tested. Sign number 6, swollen or tender testicles. Guys, your testicles are trying to tell you something. Swelling, tenderness, even a dull ache could mean epididymitis, inflammation of the epididymis, often from STIs, blocked or damaged tubes, early signs of fertility trouble. This can lead to low sperm count or even permanent infertility if left untreated. ARN number 7, fertility. Issues. After 6 to 12 months of trying, this one's the toughest to face because it comes last. By the time you realize you can't conceive, years may have passed since the actual infection. In women, STI-related infertility often comes from blocked fallopian tubes, scarring from PID, hormonal disruption, cervical damage from HPV. In men, it's from reduced sperm motility, low sperm count, inflammation in testicles or prostate, DNA damage to sperm. Okay, so your body's whispering, or maybe it's yelling by now. What do? You get tested. That's it. You don't have to cry in the shower stalk, Reddit threads, or panic alone. Let's walk through what actually happens when you go for STI testing and bust some fears while we're at it. Step 1. Talking to a provider. You don't need to know what to say. Just tell them I'm sexually active and want to make sure I'm okay, or I've had some symptoms and want to check for STIs. They'll ask when your last test was, if you've had new partners, any symptoms, type of sex you've had, vaginal, oral, anal. There's no judgment. They've heard it all. Step 2. The actual tests. Now let's break down what they might do. For girls, vaginal swab checks for gonorrhea, chlamydia, trich, pap smear, plus HPV test checks cervical cells and DNA. Blood draw for HIV, syphilis. Herpes, urine test for general screening. For guys, urine test, most common for chlamydia, gonorrhea. Swab inside the urethra only if needed, and no, it's not always painful. Blood test, HIV, syphilis, hepatitis. Myth-busting moment, STI tests are fast, easy. and mostly painless. Most results come back within a week, many in 2 to 3 days. Step 3. What happens next? If your tests are negative, awesome, that's peace of mind. If something's positive, you'll get treated immediately. Most STIs are curable with a single dose of antibiotics. Some, like herpes or HIV, are manageable for life with medication and lifestyle adjustments. And yes, you can still love, date, and build a future. Expert Insight DR. Nicole Anders, infectious disease specialist. The biggest barrier to testing isn't the test itself, it's fear, but fear doesn't protect your body. Knowledge does. Testing isn't admitting you're dirty, it's proving you care about yourself and your partners. Dr. Monica Reyes, OB, GYN, and researcher. The number of patients I see with preventable infertility from untreated STIs is staggering. These aren't people who were careless, they were just uninformed. They thought, if I feel fine, I must be fine. Testing is the new self-care. Honestly, Dr. Liam Carver, men's fertility specialist. Guys don't like going to clinics, I get it. But I've seen 25-year-olds with low sperm counts from an infection they didn't even know they had. You wouldn't drive a car without ever checking the oil. Why would you go through life never checking your reproductive health? You might not want kids right now, and that's cool, but maybe one day you will. Or maybe you won't, but you'll want the choice. STIs don't just take your health. They steal your options. And the truth is, fertility isn't just about having babies. It's about having ownership over your future, over your body, your relationships, your choices. You don't wait to care about your fertility when you want kids. By then it could be too late. You start caring now when you're healthy enough to protect it. Let me read you a real quote from an anonymous viewer who emailed us. I didn't have any signs. Not one. I waited until I was 30 to start trying for a baby. Now I'm told both tubes are blocked. I'm angry at myself. I thought if something was wrong, I would feel it. I never felt it. You don't wait to care about fertility when you're ready for kids. You protect it now, when you're young, healthy, and full of choices. Because STIs don't wait. They don't care if you're in love. They don't care if you were careful most of the time. They don't care if you feel fine, but you can care. You can make one appointment, send one text, ask one doctor, take one test. That could save years of heartbreak. At Sit Here with Teenagers, we don't shame, we educate, we inform. We help you stay in control of your health and your future. Like if you learned something new, comment which STI surprised you the most. Share this video with someone you love. Subscribe for weekly health drops that keep it real.